Hello, and welcome to the Inside Scope, a podcast from Lakeland Regional Health where we share insights from experts providing award-winning care right here in our community. I'm Dr. Daniel Haight, Vice President of Health at Lakeland Regional, and I also have the privilege of hosting this podcast. With us today are Dr. Eric Wicks and Dr. Colton Faza. Dr. Wicks is a board-certified orthopedic surgeon and sports medicine physician with over 25 years of various involvements in a multitude of physical health activities. Dr. Faza is a sports medicine physician, specializing in the non-surgical approach to help you keep active. Dr. Faza was actually born here at Lakeland Regional, and we're glad to have you back here in our community. Both Dr. Wicks and Dr. Faza provide support to many of our scholastic athletes and also care for chronic and sudden muscle injuries, skeletal injuries. Both our guests currently see patients at our Grasslands campus, and that's located on Hardin Boulevard and Edgewood.
Yes.
And let's start there at the Grasslands Clinic. When I think of patients and how they connect with you in sports medicine, where are they generally coming from? How are they hearing about the help they can get at your clinic?
Sure. So there are several resources out in the community for patients to be able to get connected in with our clinic. That may start with the primary care physician or pediatrician or urgent care or even the emergency room. We also have several athletic trainers out at high schools in the area providing coverage to the athletes at various sports games, and they may get connected to us through the athletic trainers as well.
So I see that when somebody comes into one of the various urgent cares that Lakeland Regional has, they'll actually have something that the urgent care recognizes that we need an orthopedic surgeon. We see this in your future. You need some sports medicine. Are you seeing a lot of patients coming from urgent care?
Oh, absolutely. So they get the initial evaluation, and once the very acute situation has been, taken care of, many times they need to then come over and see us for, the further treatments. And sometimes that can be as simple as an office visit, just reassurance that this is something that can be taken care of by physical therapy, maybe some injections, or sometimes it does need further imaging and leads to surgery.
Well, I like the communication you have back to the primary care. I wish everyone had a primary care. I would almost call it a medical home that you're communicating back to, whether that person is going to have other health issues. You're making sure that they're participating in activities the right way. Tell me a little bit about the team. I think that, I think the success is also often not just the team, but the tools you use. But let's start with the team. How do you two work together? Let me start with Dr. Faza.
Sure. So we work together in clinic. Dr. Wicks, some of the week, of course, is in the operating room. But in the clinic setting, we actually work right down the hallway from one another. So we're able to actually talk to each other about patients and see patients together on occasion as well. And that allows us a really close relationship to review imaging, testing, and provide the best care to the patient.
Because you'll see some patients that surgery is not the initial. So some patients might first come to you, but then you might recognize that we have some non-surgical options that you'll start, or you'll refer to Dr. Faza?
Yeah, absolutely. So even though we do a lot of crossover with how we treat people, I do have the side of that I can operate on somebody and do a surgery as needed. Like you're saying, not everybody needs surgery, and there's many times I'll refer over to Dr. Faza for various things. One of the things is somebody has knee issues that, we look at maybe PRP is a good option. So I'll refer over to Dr. Faza because he actually can offer that, and I just don't.
And this thing called PRP, I'm hearing more and more about it. Is that like using something natural that the body already makes to help it heal? How would you describe PRP? How did I do?
Yes, absolutely. That's exactly correct. Our body has platelets, which are part of our blood.
And that's the P. So P. We want to find
exactly.
out what PRP. Okay.
Exactly. They have a lot of growth, healing, and repair factors. And
so we have platelets in our body, and you can take them out of the actual patient, and those platelets have things that help a person heal?
Yes.
Okay.
They're very helpful when we spin the platelets down in a centrifuge. It creates platelet-rich plasma.
So you concentrate it. Okay.
Then we can then inject into injured tissue that maybe is not healing itself so well or is continuing to cause pain. And over time, that creates a healing response using the person's own platelets and healing factors, own natural substances in their body.
I mean, that sounds like a really aggressive approach to make sure someone's healing, getting pain-free. But I want to deal with one myth that I've always sort of wanted to understand is, do you need to be an athlete to go to a sports medicine physician? I think that's, you have a sports medicine clinic. How much of an athlete do I need to be, or do I not need to be an athlete?
Well, we have athletes at all levels, right? And even for us, we
so I might be an athlete.
You could qualify as an athlete if you're physically active individual, and in athletics can even apply to work activities, right? We have some very strenuous laborers.
So the key is activities.
Yes.
It's not so I shouldn't think of it as sports or athletics. It's I'm trying to be active, sometimes in a very organized way with rules and teams and everything. Okay.
It could be recreational too. It can be job activity, or it can be our organized sports, just as you're saying.
Oh, excellent. So, and I'm sure you've seen a number of folks that are active. What are some of the more unusual sporting activities that you've sort of helped people come in with?
Absolutely. I'd say one of the more interesting types of events I've covered would be a rodeo. And so we see a lot
I've seen how they sweat. That is strenuous.
We see a lot of riding athletes who may get thrown from a horse or injured in certain form or fashion. A lot of joint dislocations and things like that they come to us for their care. I'd say one of the more other interesting ones may be sailing. So I've seen athletes be kind of hit by the boom.
And you're cranking things and you're really moving around the boat. And what kind of athletes have you seen that have been sort of the typical?
Water skiing. I don't think people really think about the injuries that
upper
happen
body
with water skiing,
strength,
hamstring injuries for sure,
and legs,
and then boxing and mixed martial arts. So I've covered multiple events and had people come in and actually see me then in the office to take care of their injuries.
So what it sounds to me is we're trying to stress this as very important, that if my joy in life is playing darts and lifting a beer, but if it's throwing darts and my elbow is hurting me, I can see a sports medicine physician, right? Because I want to help. I want a team approach, but I also want to have that. And now we've got pickleball, basketball, all these sports out there that folks are participating in. But even if you're playing ping pong, right? If it's hurting you, what's your advice to somebody if they're involved in an activity? It's not professional. It's just fun, but they're having some discomfort. What's your advice? What's your advice to them?
Yeah, so even if you're having pain with your activity, it means you're not enjoying your activity to its fullest. And that's where we can come in and provide care, assistance, advice, treatment to help. And the goal is to get you back to enjoying what you love doing.
But so is it a myth to say, like, okay, I go out and I might play a little bit of tennis and I get a little discomfort and I'm thinking, is it a myth? Should I just play through the pain?
Ultimately, I would say don't play through the pain. If you start to feel pain playing whatever sport or whatever activity that you're engaged in, it could be a sign of something more serious going on. Mm-hmm. And so what I tell patients all the time who come to me and say, I wasn't going to keep this visit because I was feeling a little bit better. It's not as bad anymore. And I tell them it's perfectly fine. I'm here for you. I'm happy to provide that reassurance to you.
And how to avoid getting it worse too. They
Yes.
may have had that. And I think you might see patients that are on a trajectory of maybe getting better, but you could maybe see the signs that this is going to get worse if you keep playing without addressing the underlying cause.
Yeah, absolutely. I really, you have the acute injury, and everybody recognizes
the obvious.
Yes, the obvious one. It's the overuse or the chronic injuries, and those just continue to add up. And sometimes you see somebody, and they're pretty far along the road where if you could have intervened a little earlier, probably would have even a better potential to get better quicker too.
Well, I don't play that many sports, but I realize that my ability to play is getting worse and worse if I have a discomfort. And now I've changed the way I've done it. It could be the way I swing or hit or do whatever, and I'm just doing it differently and ineffective. And so I certainly need the experts to advise me, and I don't need to be an athlete, which is good. You were mentioning something earlier, and you commented on it. It's not just sports. You mentioned that you see patients in the sports medicine clinic that are just occupational. It's work related. Person enjoys their work, but they're having discomfort. Give me some examples of those.
Sure. From people with back and neck pain, just working at a desk all day, they may need ergonomic changes or certain exercises to strengthen their spine, to even mechanics or people who are lifting a lot, hard laborers doing a lot of repetitive motion.
Yeah, because I've seen
with their
folks
body
just
parts.
trouble with their hands, but you
Yes.
might have suggestions with that. And those suggestions, I think, brings into what we started earlier, is talking about the team. You got the team, you got the tools. What are some team members that you have that are rounding out all the expertise that you're putting forth to the patient? What are they doing in the clinics?
So one of our incredible team members or team that collaborates with us are physical therapists. They really are a cornerstone of helping to get people better as well through different treatments. Yes, it's exercise. Yes, we're doing flexibility and strengthening, but there are a lot of educational components to physical therapy that are very important. How to move, how not to move, and how to do certain exercises.
And do you find that when they interact with the physical therapist that they're also giving them tools when they're not with the physical therapist? Is there a lot that combine that they can take home with them, or even during the sport or the activity?
Absolutely, and that's really a lot of the goals. Is when I'm sending somebody to physical therapy, it's what is going on in the hours that they're not with the physical therapist, and the physical therapist will get them those home programs and educate them, maybe with technique changes as well for what the activity is that they're doing to make it actually easier and better for them.
Yeah, when I see patients in the hospital, I always say every time you see a commercial is a time to be lifting those things up, that get some extra bending your legs, to get moving around with that. Now, okay, so what are some of the tools that you're using in the clinic? What do you have at your disposal?
Cornerstone of my diagnostic as well as treatment practice is ultrasound.
Ultrasound.
And so I have a lot of people that might come to me and say, well, I thought that was just for babies. It's not just for babies anymore. So we actually can employ ultrasound for various musculoskeletal injuries or chronic issues to help diagnose issues as well as help with treatment. I do a lot of injection therapies, whether it's cortisone or platelet-rich plasma or other types of injections.
So
as well.
cortisone is when you get an injection on a site that's hurting you. And to me, I always learned that pain was caused by inflammation. Inflammation is my immune system. But cortisone helps tone that down, and so that's the injection. What are some areas that commonly get injected that in both y'all's clinics?
Very commonly, I'll inject shoulders, knees.
Yep.
I also inject ankles, elbows,
Shoulders,
wrists.
knees.
Pretty
Yep.
much
So
everything.
Quite a few. What are some of the downsides to these injections? Is there anything other? I know you numb up the area before you do the injection, but is there any downside to the injections?
Well, the positive side of the pain relief is good. Usually the body's over-responding a lot of times to injuries and such. Long-term cortisone injections can actually cause some breakdown of the tissues. So you do want to actually watch how often and how much you're doing. That's when it gets to the point to where you've got to look at some other options.
So
and
you
that's
get
what
an
a lot of
injection,
times-
yeah. And then you wait a while, and if it starts wearing off, maybe another one. But then you have to. These are great questions that I think we really. What you're saying is you really want your patients to be asking these questions. It's like, well, how many times can this happen? What are the positive effects, and how can we work on that?
And then you have the fancy things with the orthobiologics, as we call them.
Yeah.
That's the PRP and the other types of injections that he does. And I send people over there because it's part of his practice and not part of mine. So we all have our place, and we feed off of each other and interplay.
So this injection of platelets, the PRP, this is using something natural into a site that you want to heal because what you're injecting stimulates healing. Is those in the same spots that you're healing, or is there particular places that really do well?
PRP has been studied pretty extensively for chronic tendonitis issues. So your tennis elbow, your golfer's elbow, your Achilles tendonitis.
So tendons is where the muscle is attaching to the bone to cause it to move, and it's that tendon that gets inflamed. And so with tennis elbow, golfer's elbow.
It's a very common cause of chronic joint pain. That may limit activity or motion or sporting. Another place that PRP has been used for is arthritis. And so we've started to use it a lot for specifically knee osteoarthritis, but some other joints as well, hips and shoulders.
Oh, wow. Well, the thing is that you're doing things that are helping the person heal faster. You're really getting the technology that's been proven. And with the Bear procedure, you're able to take something that you're making it rather unique. It's not something that you can find just at any facility. You're doing it right here in Polk County.
Right here in Polk County, so you don't have to leave here. I was the first one to actually do the Bear procedure, and having that as an addition to my reconstructions of ACLs to just such a terrible injury has really been a nice addition and been able to help.
Well, I know how that particular tendon that connects the two bones, when it got injured in the past, y'all just took it out and got a replacement and put it in there, and that is not as ideal as keeping the original and repairing it.
If you have the ability to repair what's already there, we like to defer to that. But, there still is a place for reconstruction and a reconstruction is actually making a new ligament for somebody. The repair is taking what's there and actually fixing it.
Yeah, and then you noticed that you were saying how the healing time was a little bit faster.
We've really noticed that, and this is what we're seeing across our studies, that we are seeming to have people get back quicker off of the repairs. But, there's a place for all of it.
Well, I injured my knee just from trying to get out of the way of a fireworks, and I think that wasn't sports, but it was being active. And getting that kind of advice, now I know what to ask my doctor. I want to ask about, what's the different options? And I think we advise this to all patients. First, find out what matters most to them, and then get them to make sure that they're asking the right questions. And I think the question would be, what are all the procedures and options available to me? And get that good advice. When you see patients, what are some of the things you sort of wish they were asking, and you sometimes prompt them that, you love it when a patient comes in and asks these questions. What are some of the questions you like them to ask?
Sure. One of the biggest questions that I want to hear from a patient is what their goals are, or basically what are they looking to get out of it? Yes, they're in pain. We want you to be out of pain. But are we looking to get back into sport? Are we trying to get back to work? Are we just trying to be more active with our lives?
If I said, yes, I have pain, and I want to not just be pain-free, but I want to just be able to run a marathon with my daughter.
Exactly.
In 5 weeks. Now you can talk about, okay, well, here are some of the options with that in mind, and it may not be enough time to do this or do that. And that, again, you end up with someone who goes into it fully informed, like knowledge is power. So you feel that they feel that they're helping with their own health care. Excellent. And I think knowing and learning a lot about the Bear procedure is just that, and all the new technologies that are coming down. So that's glad you're on the forefront of that.
We're getting more each day, from his PRP to my Bear.
Yep, and seeing that our community's growing and they're becoming more active. I mean, there must be dozens and dozens of athletic fields all through Polk County, and I really think the community sees that as, it might be hot, be careful with the heat, but be out there and be active. Tell me what's going on with the schools. I think a lot of the athletes, I think one of the reasons I'm in certain sports is because I did it as a child, and I just grew with it. Created lots of bad habits on the way, but, I want to stay active. But I see that you all and your team is actually involved in scholastics with athletic trainers with certain schools. Tell me what's going on there, because I think this is a critical part of getting the right athletics when you're young, so you can continue that.
In order to serve the community more fully and have medical personnel out on the fields, because a lot of injuries can happen on the fields, and it's not just musculoskeletal injuries, it's heat illness, it's concussions. There's kind of a broad range of different things that can happen to an athlete. Our athletic trainers go and staff those games, and they provide medical care and assistance to the athletes as needed.
Excellent. And you were talking earlier is that sometimes it's not the athletes on the field. Who else can be at risk?
You could have coaches. You could have even people in the stands. I think all of us have our story about when we've had to go beyond just the playing field to actually help somebody at a game we've been at. And you'll see us out there at games, throughout the county. You'll see us at the colleges as well, because we actually cover as physicians at the local colleges too. So.
Yeah, and I think just being out there to have that kind of expertise and being able to have, the kids are in the right environment, knowing that they're performing the athletics in the right way. Anything else you'd like to add as far as what's going on in the community and what you're seeing in keeping active? Oh, I did actually have one question before you answer that.
Sure.
I know of a lot of folks who were very high-end athletes when they were younger, and they had bulked up and they were very strong, but now they're 10 to 20 years after retirement and still wanting to be active. And I'm really concerned, is this a big issue for folks who were former athletes in their high school and college days, but now they're 40, 50 years old and maintaining that? What are some of your experiences there when a former athlete is trying to keep up, and I don't know, maybe a little bit of diabetes has started, or maybe the arthritis is setting in? What are some things going on with that?
Yeah, and one of the most difficult things about retiring from sport and aging is the aging part. Mm-hmm. And as we age, our tendons aren't quite as strong, our muscles aren't quite as strong, our bones may not be quite as dense. And for a retired athlete, it can be difficult, especially mentally, to realize that they can't push themselves or be quite as strong or quite as fast as they were before. But that doesn't mean that there's not a place for being active or participating in sports. And that's one of the cornerstones that we're passionate about, is as people age, keeping people active and doing what they love doing.
Mm-hmm. Excellent. Any inspirational stories? You've interacted with so many people that want to stay active, and to me that can be very sad if you can't do something you loved. Do you have any inspirational stories?
Well, one of mine is a volleyball player, high school athlete, in her last season, and she tore ACL in volleyball season.
And that's part of the knee.
Yes.
And volleyball. I mean, that's a lot of twisting, jumping, upper body. I'm good at the jumping. I wasn't very good at the landing. Unfortunately,
that's where it happens. The injury with the landing.
The landing, yeah.
And they were very motivated, wanted to try to get back to play lacrosse that same year, and with the ACL tear, I was able to actually offer them something that is a little different. I was actually able to repair the ACL with something called the Bear, which is, people are hearing more about it, and it gave me the ability to actually repair her ACL. And with hard work, she was actually able to make it back on the field in 6 months, which is very quick. But we're kind of seeing that with the repairs, if we can do them, versus what was the gold standard before of doing reconstructions.
Well, I've heard so much about ACL and how that knee injury can really take a long time to heal, but the Bear procedure is really you're helping that heal a lot faster. And you're using the person's original ACL. You're repairing it, but you're wrapping it, much like you described with what we saw with the platelets. You're wrapping the ACL with something that's helping it heal.
Yes.
And it's natural, and it just dissolves and resorbs itself. Wow, I mean that's amazing, being able to take those cares. Any inspirational stories that you've come across?
I'd say my greatest inspirational stories are often taking care of athletes with concussions. Yeah. Our goal oftentimes with our athletes is, yes, we want them to get better. We don't want them to get re-injured. But they're thinking about their next game or their next practice or their next tournament. And I'd say one of the most rewarding parts about taking care of athletes, especially with concussions, is getting them better and getting them back into play.
And the reassurance, because to me, I think what you all have told me before is that you're really concerned about what matters most to your patient. And you just described what the patients are telling you. This is what's most important to me about my injury, what's going on. But it's also the family. Family cares a lot about understanding and respecting a person's privacy, but understanding, how do I get through this event? And so you're helping them through that. It's amazing that you're not just taking care of athletes with muscle and skeletal injuries. You got concussions issues that you're dealing with. You've got the potential ways of healing faster is amazing. And then it's don't have to be an athlete. If you're doing something, you're the guys that are going to help out your team, from the receptionist on into the medical assistants. They're there to help. I really want to thank you all for you and your team and your schedulers and the folks in the hospital, because you're helping Polk County stay active, stay healthy.
And if I could, one of the things I wanted to add is we don't necessarily have an age limit of people who we see. So we may see young children even to the toddler. I've seen as young as a 2-year-old.
Really?
And we see patients all the way up through their 80s and 90s and beyond.
Yeah, because they want to keep that activity.
Yes, and it's really the injuries are, there's a little different way that you have to treat the pediatric patient, but that's what we're trained for. So, I see patients that are even 10, 11, 12, even younger. He does as well. I've operated on preteens and teenagers all the way up to your, I guess, geriatric population.
Yeah, and no matter what the activity. So if I'm playing checkers and I hurt myself kinging myself, it's an activity. I am moving. It hurts me. You're going to help me, and your team's going to be there. Yeah. You got the tools. You got the great location there at Grasslands, and I just want to thank you for everything you're doing. You're keeping us going. All right, thanks a lot. Appreciate it.